And the coronavirus is back, or did it ever really leave? The health ministry announced that Israel is now seeing a 30% spike in daily COVID-19 cases and has instructed hospitals in Israel to begin testing new patients for the virus. And so joining us now with more is Professor Cyrille Cohen, head of the immunotherapy lab at Bar-Ilan University. Cyrille, it has been quite a while. Great to have you back.
Thank you, Lida. Good to be here. Unfortunately, the consequences are not that good.
So first of all, what can you tell us then about this spike? I mean, what's causing it?
So basically what we know is that around the world, there's been an uprising of the, I would say, of the COVID, mainly based on a rise in cases, mainly based on several, I would say, variants. But the most prominent variant is what we call the variant Iris, which has become the dominant variant in many places in the world. We believe that this is a combination of two things. One thing is because this variant has a few more mutations, and therefore it can, I would say, evade the function of the immune system, the surveillance of the immune system. The second thing is that it's been a while since, some of us got vaccinated. It's been a while since some of us got also sick with COVID, and therefore it is believed that there is, I would say, a less, I would say, less important activity of our immune system facing COVID, and therefore COVID is trying to take advantage of that sub-immunity, or I would say this immunity that is not perfect, and therefore that's why we are seeing a lot of cases, including we just got a report now that in the White House, actually Jill Biden got COVID. So it's really widespread.
So really widespread, I mean, not just here in Israel. Is this variant concerning at all? I mean, what are the symptoms that we're seeing with it?
So the good news to some extent is that we haven't seen a change in I would say, the different symptoms that are experienced by people that are sick, meaning we're still talking about a variant that is in line with what we know regarding Omicron variants, meaning very, very contagious, but not in general for people that are healthy, causing a disease that is, I would say, dangerous or able to cause complications. But that being said, unfortunately, when we see a rise in COVID, we also have to take into account that there are people in the population that are weaker, people that are, the elderly, people that are with comorbidities, or people that are immunosuppressed. And those people are actually at risk. And when we see a rise, unfortunately, in the number of cases, we see also a rise in the number of people hospitalized, and we have seen that in Israel.
But, since the coronavirus has been downgraded from a pandemic, why the need to test now? I mean, why test this? I mean, do we test for the flu or for other viruses as well?
So, yeah, that's a good question. So basically, just so you know, we are testing for flu. We are testing for flu every year. It's more like, in order to understand, what is the dynamics of, the flu season, to know when it starts, when it ends, and what kind of shape it's taking every year. So there are tests that are being done. But the second thing is that we are not in a very stable, I would say, situation with COVID. We are, unfortunately, navigating in a kind of, blind way, because we are navigating blindly because we don't have enough information about the different variants. Just so you know, all the variants are being tested. One of the latest variants, the Pirola variant that we are also, following, has been detected, in Israel and in Denmark. This was the first countries that detected it. And how? Because they were testing. So yes, we are testing, and we do believe that in an environment that is actually sensitive, like hospitals, it is a good thing to know if a person has COVID or not, because we don't want that to spread to other patients.
Now, do you think the health ministry will be implementing any additional measures to try and curb the spread?
Right now, we don't believe that there is a need for further measures. People have been talking about masks. Masks could be recommended, but there's not going to be a mask mandate. at least, in the present state of affairs. And the other thing that we might, again, recommend is testing. Test yourself. We are approaching Rosh Hashanah and the New Year events. If you know that you're going to visit someone that is, old, that is sensitive, that has a comorbidity, test yourself so that you can be, sure that you won't, unfortunately, cause any harm. So we believe that these are things that, should be done. We also, can talk about the fact that open space is much better than crowded space and confined space, et cetera, et cetera. So these are things that we can recommend, but at this point, we don't see any drastic measures. The only thing that we can talk about right now and are counting on is perhaps for those people that are at risk, vaccination that should start next month using updated vaccines.
For those at risk. All right, well, Professor Cyrille Cohen, always a pleasure to speak with you. Thank you, and good health.
Thank you to you and to your viewers.